do, if you've joined, just say, if you can, just say hi in the chat and where you're from, just so as we've got a sense of who's in the room and you can get to know each other. So if you're feeling brave, jump on the chat and say hi. That would be super helpful for us. Okay, we've got lots of people that joined, so let's make a start. You may have heard at the beginning that this webinar is being recorded, so just to let you know, it is being recorded, but please don't let that put you off in any way. So welcome everyone to this webinar where we're going to explore the More Than Bricks research project. Shelter has been working with HACT, the Housing Associations Charitable Trust, to carry out a groundbreaking longitudinal research project looking at the impact of moving into a social rent home. And you'll all know, and hopefully had the chance to have a look, that in September, Shelter published the first interim report from the project, sharing those emerging findings, exploring social tenants' experience in their new home 3 months after moving in. We're going to hear more about the report today from our 3 brilliant panelists. We're going to dive into the motivations, the findings, the methodology, and we're also going to talk about how important it is to genuinely work collaboratively with people who have lived experience to design and deliver robust research. For those of you who don't know me, my name is Catherine Ryder, and I'm the Chief Exec from an organisation called Place Shapers. We're a network of about 85 housing associations across England. And I have the privilege of chairing this webinar today. I'm also joined by Hannah from Shelter. Hannah leads on Shelter's research work on social housing, and including managing this longitudinal research project. So you'll hear from Hannah. You'll also hear from Maria from HACT. So Maria is a research consultant at HACT and a research fellow at the University of Birmingham. And Maria specialises in social housing, social impact and place-based services. And then you'll also hear from Jane, who's a member of the Lived Experience Advisory Panel. Jane has been a social tenant in the West Midlands for over 30 years, and she contributes her expertise through this project's advisory panel. The session is going to work in that we'll hear from each of our speakers in turn, and then we are going to turn to the question and answer and any comments and reflections from you. So as we're going through the webinar and hearing from each of our speakers, please do contribute through the chat and through the Q&A, and questions for our panelists are really welcome, but also your reflections on the research. Like, are you surprised? Does any of it really resonate with you? How do you think this research sits with what you were expecting? So please do contribute as we go through, and we'll come to all of your questions and comments at the end. I've been really pleased to see this work evolve. Worked in social housing for about the last 12, 13 years. And in my experience, we talk a lot about the economic impact of building new homes, and rightly so, because they make a huge difference to the economy. And we also talk a lot about families on waiting lists and families in temporary accommodation. And again, that is really important. And sometimes we talk about the quality of social housing and the stability that it brings into people's lives. But in all the time I've been working in social housing, I think this is the first time that I've seen an organisation trying to measure the difference that social housing is really making to the lives of individuals, to the lives of people who have moved into social housing. So I think it's brilliant to see this research, and I'm really interested in the emerging findings and what this research will tell us over time. So we're gonna, as I said, we're going to hear from each of our speakers, and then we'll turn to questions and contributions from you all. So please don't be shy. This will be a much better conversation if you all get involved. So we're going to hear from Hannah first. Hannah, can you just set the scene for us? Tell us why Shelter did this work. Tell us how it aligns with all of your fantastic campaigns, which people will be familiar with, I'm sure. And then if you could just touch on the rationale for working closely with tenants, and then just tell us a bit about what you found through the research. Hannah, the floor is yours.
Thanks so much, Catherine. And yeah, thanks everyone for joining today. Yeah, as Catherine said, I'm just going to set a bit of the context around kind of the motivation for the work, and also talk through particularly working with people with lived experience, and then talk through kind of some of the findings and delve into them in a little bit more detail. So bear with me, I'm just going to share my screen so I can talk through some slides. Hopefully everyone can see that. Great, yes. So I'm going to talk, as I said, I'm going to talk through a bit of the motivation up front. So as a bit of, yeah, as an overview, kind of the overall aim of this project is really to gather evidence around the impact of moving into a social home. And it's to kind of help shift public attitudes towards supporting social housing, obviously aligning very closely with Shelter's campaigns around the need to build more social housing. And within that, there's kind of various things we want to delve into in terms of the impact on the various different parts of people's lives. As Catherine was saying, that was a key focus, is kind of really understanding what it means for individuals, why people might have slightly different experiences. For example, if they were previously homeless or living in private accommodation. And we also, yeah, a really key objective is around kind of embedding that lived experience insight into projects and kind of learning how best to do that. So a bit more about the motivation for the kind of research project was, I guess the key thing is really around, we wanted to build on lots of great audience insight and framing recommendations around how we talk about the need for more social housing. So JRF and Nationwide Foundation have done lots of work with frameworks to look at how we can do this, particularly talking about kind of homes as the foundation for people's kind of healthy lives. And I think that, alongside obviously wanting to kind of keep the pressure on government, as well as that wider sort of public focus. We also wanted to build on that sort of evidence gap that Catherine mentioned. So there is a lot of evidence around the economic benefits of social housing, but we really wanted to hear directly from tenants themselves. And that's also sort of building on some of the work that Shelter's done around the Made in Social Housing campaign, which people might be aware of, which was a couple of years ago, where we were highlighting stories of people in social housing. So we wanted to sort of approach it from a research perspective. And so the result was this longitudinal research project, which is sort of tracking people after they've moved from homelessness and private renting into their social home. And then a bit more context around sort of how this is a bit more around the motivation for why we wanted to involve people with lived experience in the project. So this is a summary of the sort of co-production principles, so things that we were thinking about when setting up the project and how we could best do this. So I guess this is, we really wanted to set up the lived experience panel. So Maria and Jane are going to talk a little bit more about this from different perspectives, but I guess this is around kind of why we wanted to do it. So we wanted to make sure that we were embedding these principles in the project. So for example, that we were kind of using it as a way to kind of build relationships with people. So we weren't just sort of extracting people for information in terms of them participating in the project, but kind of working closely with social tenants to guide and shape the project through the lived experience panel. And yeah, Maria will be talking through some sort of learnings around how we've done this, because obviously these are all great things we should be aspiring to, but I think we're always kind of learning how best to achieve these principles. So this is a sort of summary of the project timeframe, because the main way we're collecting this evidence around the sort of impact of moving into a social home is we're doing a longitudinal survey. So that means we're surveying the same social tenants over time, so up to 4 times. And this sort of is tracking how many responses we've received so far. So obviously we're sort of in the middle of the project, it's an ongoing project. And we've just started to collect, or quite recently, the sort of wave 3 findings, which is looking at the impact 9 months after moving in. And we're going to be tracking those same measures over time, which is around health, children's lives, employment, finances. And so, yeah, we're almost due to start collecting wave 4 in the next month or so. And the next slides I'm going to talk through is the findings we shared in September. So those were based on sort of emerging findings from that Wave 2 survey, which is looking at the first 3 months. So it's obviously quite a short time after moving in, and what we're really excited to see what those findings will be over a longer time frame. So as Catherine mentioned, in September, we published the kind of More Than Bricks report, which is the sort of interim report from the project so far. And at the time, we'd heard from 134 tenants who'd taken part in those first 2 surveys. And HACT had also carried out 22 interviews of social tenants to kind of explore the impact. And we took the report to party conference, and it was and had a sort of event, and the stall was centered around the findings from the research. So to delve into the findings in a bit more detail, so I think the sort of impact on the immediate improvements to people's health and well-being was a really key finding that came out from the research. And this also kind of nicely aligned with the kind of framing of health being a really important way to talk about the importance of home and the importance of social homes. And I guess, the key finding was that 6 in 10 tenants have seen a meaningful improvement to their mental health just 3 months after moving into their social home. And this was due to a few different factors, including kind of people feeling less stressed and worried about becoming homeless, reporting sleeping better. And from interviews, this was particularly the case from households moving from temporary accommodation, where they might be sharing kind of beds or bedrooms or even beds with family members. And there are also some kind of improvements around eating as well, which particularly if you're moving from homelessness where you might have kind of cramped conditions and it's difficult to kind of cook. So this was kind of the sort of headline finding from the report, the findings so far. And I think the sort of moving into this affordable and stable home, I think, is a key way for us to understand why we've seen that kind of immediate improvements to people's health and well-being. So tenants reporting kind of they're better able to afford their bills, 2/5 of tenants. I think what's quite a striking finding is half of tenants who were in debt before are no longer in debt, and this is obviously within 3 months of moving in. I think that's a really interesting finding. When one will be interesting to see how it changes over time, and this also means people are sort of better able to plan for the future as well, because of that sort of knock-on effect of having cheaper rent, which means they're better able to afford other things and kind of save for the future. The final key sort of theme or finding from the research so far was around this sort of sense of belonging, space to thrive. So I think, interestingly, tenants were reporting they've kind of feel a better sense of belonging now they've moved to their social home, which I think is definitely to be understood in the context of kind of social homes providing that stable home, that long-term home, which they might not have had before, particularly if they were private renting or living in a temporary accommodation, for example. There's also kind of better access to green space, and parents also report that their children have suitable space to play whereas they didn't where they were living before. So I think the findings of families and children will definitely be looking at more as we kind of gather more of an evidence base on that. And then before I talk about kind of where we are in terms of the project before handing over, there's just delving into a couple of the findings in a bit more detail. So something which we found really interesting was, so far around half of tenants say they're better able to afford rent due to moving into a social home. I think we were slightly surprised by this. Maybe we were expecting this to be slightly higher, thinking about where people are moving. But I think something that came out strongly from interviews was obviously people are there are kind of costs associated with moving, having to buy furniture and pay for the move, which could mean that people aren't maybe seeing those immediate benefits because they're having to kind of maybe spend more of their rent on things like that to cover the cost. We also aren't yet able to look at how that might differ for people who are moving from a private rented home as opposed to kind of homelessness. So we would expect that to be higher if people were previously private renting and obviously paying kind of higher rents. But that's something we'll definitely be looking into in the later waves. And I think the other interesting finding around community is that actually quite a lot of people did live close to kind of key public services in their previous home. But what we saw is a really kind of quite significant improvement to people being able to access advice locally compared to where they were living before. And I think this could be in part because we've seen there's people are reporting that they have a lot better connections with their neighbours, but also with their landlord as well, which could help to explain why they're kind of better able to access that advice. So again, that's something we'll be interested in and kind of tracking over time, that kind of community focus. So before I hand over to kind of delve into some of the methodology a bit more, just a final one on, I guess, where we are in the project. So we're very much still an ongoing project, and we'll the focus is kind of getting the longitudinal interviews completed by spring and continuing to collect the survey data over those multiple waves. At the moment, we're thinking about how we can best align this with Shelter's wider campaigns around social housing. And so it's going to be a focus of our work over the next year, as we're talking more about kind of how can we get these social homes built. Obviously, we've got the kind of investment in social housing and the spending review with the new social and affordable homes programme. So the focus will be on kind of how do we show the benefits of these homes? How can we kind of encourage councils and others to kind of build the homes with that funding and kind of through other means. And the final launch of the project will be in early 2027 when we've collected that sort of data around the long-term impact. So I think that's all from me at the moment. I will stop sharing my screen.
Great stuff. Thanks so much, Hannah. Really useful to get that kind of context and those emerging findings. And it'd be good to get people's reflections on that. And some of the things that you talked about from the, like instinctively, I think we thought they were true, right? But we didn't ever really have the kind of evidence that you're now able to pull together. And I also think you're right, that 39 billion, it's a lot of money, but we can't all be thinking, oh, job done. Like we've won the argument around social housing and we're going to go and build thousands of new homes and this problem is solved, because it's still absolutely the kind of, the tip of the iceberg in terms of the funding that we need and the momentum that we need behind social housing. But really good. Thanks so much, Hannah. Maria, just dive in. Tell us about the methodology. Share your insights from setting up the lived experience panel. How did you go about this work, Maria?
Thank you. Hi, everyone. So my name is Maria Antonievich. I'm a consultant in HACT, and together with colleagues at HACT, since spring 2024, I've been part of kind of delivery of this project. And that's very much what I'd like to talk today, is about the how of this project. Hope you can see the slides now. Yes. So what I'd like to talk today is how we set our advisory panels, how we developed our impact framework, and about our methodology. And finally, I'll share some learnings and some challenges that we've encountered over the last year and a half that hopefully will be helpful for others who may be delivering similar projects in the future. Okay, so before I discuss methodology or any impact framework, I would like to start by talking about how we set up our advisory panel. So from early on, we knew that we wanted to reintegrate and integrate different types of expertise and co-produce the research with both people who have land experience and professional experience, but perhaps more importantly, with people who have lived experience of social housing. So throughout all the phases of the project, and including at the very beginning, in terms of creating our research framework, we involved both our advisory panels. So we have our land experience panel, which is made of 8 representatives from 8 sector leading organizations, including TPAS, Tenant Participation Advisory Service, and National Housing Federation, and Stop Social Stigma, Stop Social Housing Stigma, and JRF, and also some relevant academic researchers as well. So this panel was recruited by HACT. And then we also have our lived experience panel. It has 12 members. And from very early on, we wanted to make sure that the panel is representative both geographically and also demographically. So we targeted some housing associations to recruit members to our advisory panel. And while at first we really wanted to have new tenants to social housing, so people who moved to their social housing home within the last 6 months, few people dropped off. And once we followed up, I think it transpired that they were quite busy building their new home, which is very understandable. So we offered some one-to-one interviews to contribute to the project, but also recruited some tenants who had more experience. We were more experienced and also were very well connected to the community to really enable a wider perspective around what it feels to move to social housing and what impact that may have. So since May 2024, we facilitated 8 online meetings with our lived experience panel. So we run them roughly every quarter or so, or when an important milestone in the project, such as a report, comes up. And we really tried to follow the co-production principles in this project when developing relationship with members of our lived experience advisory panel. So we really try to be transparent about what we can change and we can't change and why. We wanted to be, and I think we were open to ideas and allowed to be challenged by members of the advisory panel. And I think that relationship the relationship building really worked because more than a year on, we're really grateful to still have most of the initial members of the panel still on board and still involved with the project. And recently, we also had a session with members of our lived experience panel when we wanted to kind of take stock and have a conversation about their experience contributing to the project. And a number of panel members said that they felt more empowered and more engaged in the way we run the panel compared to their landlords, which was really great to hear. And I think overall, they provided positive feedback around their role as kind of critical friend. And there were definitely strong kind of sentiments that they were not afraid to assert their views or opinions in the meetings, which was very much welcome. So I'll talk about the way that the panel this experience panel contribute as I go along as well. So next, I'd like to talk about our impact framework and also our methodology and developing the project. So we started conducting literature review early on that allowed us to understand the existing evidence of the impact social housing has to people's lives. And similarly to what Catherine was saying and Hannah was saying before, it transpired that there's quite a bit of evidence about economic case for social housing, but not as much about kind of experience and kind of social impact that social housing has to people's lives. And more specifically, that social rent housing has to people's times over a longer period of time. So on the back of this literature review, we started developing theory of change that allows us to understand what type of impact we might expect to see in people's life over short, medium, and long term, and also how we want potentially to measure that impact. And from theory of change, we then develop our research framework where we kind of systematize different types of impacts that we might see and also that we want to measure. And then matched those types of impacts to our survey and our interview questions to make sure that we measure various types of impacts. And we had to kind of cut some of the types of changes that people experience in their life just because we tried to kind of be succinct with our survey as well and our interviews and have a balance between what we can ask in the survey and have more targeted questions or measurable questions, and then interview questions where we can kind of get into a bit more detail. And at this stage, lived experience panel provided really a lot of valuable impact and introduced a lot of complexity into the way that people's life change when they move to social housing. So ideas around kind of greater focus on accessibility in social housing, around the role that local services have to people's lives, what it means to be able to stay in the area that people want to stay, or if they don't want to stay. So these kind of ideas really allowed us to unpack impact areas and impact categories that then fed into our research framework. And yes, so in terms of the sort of moving more to the methodology, a big part of, or kind of at the core of the project is tracing people's outcomes and experiences over time. And here we used HACT social value methodology to measure that change. So in the first survey, as Hannah mentioned, we ask people about the experience in their previous housing. So that allows us to establish a certain baseline that in subsequent surveys we then are able to compare with. So we can say, okay, 3 months after moving in, 6 months, a year after moving in, we can observe certain changes in people's lives. But we only measure movement from negative experience. So, for example, strongly disagree or disagree to positive experience. So it might be that people disagree that their home has a positive impact on their health in their previous housing, and the movement when they say in following up surveys that their current social home has a positive impact to their health, that counts as a meaningful impact. But kind of, and I can talk about it later in Q&A around kind of why we're not considering movement from neutral category to positive experience as enough evidence of a meaningful change. Now, in terms of methodology, so this is a mixed method longitudinal study where we, as I mentioned before, track people's outcomes over time, and we collect data through surveys and interviews. We have 4 waves of interviews where we follow up people and measure the short, medium, and long-term changes to their lives. We rely on our partners, so social landlords, both housing associations and local authorities, to share the link to the survey on behalf of us. And we also provide incentives, so £5 voucher for completing the survey. So overall, we also have 3 rounds of interviews, again, to track different types of impact over time. And the interviews allowed us to really measure, get a bit more detail around what it means to go into to experience a certain change. I also want to mention that lived experience panel provided a lot of feedback around on the questions that survey questions and also interview questions, including feedback on the language that we use. And we were able to test our survey and interview questions with individual members of lived experience panel through one-to-one conversations, and then kind of test the survey to see how much time it takes, what it feels like to do the survey before we open it up to the public. Yes, so we're delivering around 100 interviews across the three ways. Now, working with landlords is a big part of the project. So when the report came out in September, at the time, we were working with 33 landlords across the country, but we're kind of doing ongoing recruitment. So if there's anyone who still wants to get involved, we'd be very keen to have you on board. And relationship management has been really key part because we rely on those relationships to make sure that we collect good quality data and collect it on time as well. And I'll talk about that a little bit. Actually, it's a good segue to kind of talking about learnings and challenges where that relationship management with landlord is really a key part. So as I mentioned, we relied on nearly 3 dozen organizations to collect our data, and probably more than double of that number of people who were indirectly involved in kind of making this happen. So this does leave some room for mistakes, including kind of targeting somewhat different audience and such. So it was really important that we find almost like internal champions and really relevant people who we can support to make a case to take part in this project to senior management in each organization. And each organization has different processes and different ways of doing it. So I think at first we were quite optimistic around the time it would take to operationalize the research. But we had to introduce certain flexibilities in the way that surveys delivered in terms of how it's shared to accommodate for existing surveys, for example, because a lot of landlords already have surveys at the point of moving in and start of the tenancy. Yeah, so there was a lot of that relationship management was supporting those kind of internal people that we have relationship with, following them up individually and making sure that they also support us in reaching those targets in time. And the last thing, and then very quickly I want to talk about learnings from low response rate and also from working with the lived experience panel. So shortly after the beginning of the project, we introduced incentives, so £5 vouchers to say thank you for taking the survey, and they did prove useful. We also, for waves 2 and 3 and 4, we also introduced follow-up calls to kind of encourage people to complete the follow-up survey, and that also proved to be very helpful. And things like highlighting that it's shelters research, so using kind of shelters brand, it has nothing to do with landlords. We're not sharing data with landlords, and reassuring respondents about it and about the way that we're kind of using this data to inform shelters campaign, seem to also provide positive results in terms of increasing that response rate. And the last thing that I quickly want to cover is learnings from lived experience panel. So we, again, kind of following those principles that Hannah shared around good co-production, we try to reassure accessibility so that a lot of people with different needs can also input in the project. So we ran online meetings at 6 p.m. in the evening that would last about an hour. We also offered one-to-one phone calls for those who couldn't make it to the evening to the meetings. We made sure that we circulate material, including slides, well in advance as well. We also try to keep people involved through different kind of ways. So generally keeping them informed of what's happening in the project, where we're at. And overall, I think we had to strike really kind of fine balance between sharing too much detail, asking for too much detailed feedback. So for example, feedback on a long report, and then respecting people's time. So when we were able to get that feedback in the meeting, that seems to be most useful when people didn't have to go through a lot of material at home before the meeting. And yes, and I think kind of trying to follow those good co-production principles really made the contribution of the experience a success. But I'll let Jane speak to that. So thank you. Happy to answer any questions about research later on.
Great stuff. Thanks so much, Maria. Like, really helpful to understand how you conducted the project, but also the kind of lessons that you learned along the way and how you might apply them to kind of future projects along this line. Really, really useful. We're going to go to Jane now. Jane, as colleagues have said, is going to give us a more in-depth insight into how she felt working with the research team as part of the panel. Jane, any reflections you've got on the findings so far? Is there anything you like? That's surprising.
Yeah.
And then Jane, if you could also talk about your involvement and like, why did you give up your time for this project?
Right. So obviously I'm well set in my home, and I've lived in social housing, particularly in this housing association property for 20 odd years, and I have been a tenant for 30 odd years. So for me, the reason I got involved in the project is that I think governments need to start looking towards helping people of sort of who haven't got the aspiration at this point to buy a property. There are lots of people out there that are quite happy to rent a property. So that was one of the drivers for me. You know, like, everybody says a lot of bad things about social housing, but there's a lot of good things actually associated to being a social housing tenant. All the things that obviously Hannah and Maria have just discussed. In terms of getting involved in the project, just to give you a little bit of a brief about myself. So back in 1988, so I'm going to take you back in time. My husband and I were starting out obviously on our journey. And we did think to buy a home, but deposits were so huge in those days, and we faced what was called gazumping. So literally you could secure some money, but it was sort of limited to what you could afford to buy. you'd think that you'd secured the property, and then the next day you'd get a phone call saying, oh, sorry, somebody's offered more money. So that actually failed us miserably. We did look towards going to private rented, but every property that we turned up from was extremely unsuitable. It just felt unhealthy, expensive. And so we decided to approach the council. But when we approached the council, they were very kind of abrupt in saying, oh, sorry, the lists are so long, you may have to wait 10 to 15 years, which obviously is a bit of a thing to be told. But in those days, you could actually go directly to a housing association and sit on their lists. And we were lucky to get a 1-bedroom flat. So obviously we moved into that flat. And then the lived experience around that is it's affordable rent, so we can still save. So obviously, as we've all alluded to, when you move into a new property, you've got to buy furniture. But it gave us the opportunity to be able to build that home around us. And as our needs changed, our housing association were very good. So obviously, as I had a daughter, we moved into a bigger property and stayed on the same estate, which meant that we didn't have to move out of the neighbourhood where we'd sort of settled our roots. So it felt more positive. I mean, I've got something called a secure tenancy because of the year that I started my tenancy, which means that I'm very confident that as long as I pay my rent, which I always have done because that's the priority bill, I'll always have a roof over my head. I won't have those stresses and worries. And the one thing that I did talk to the project about, to Hannah in particular, was the fact that when I had my daughter, because we could afford the rent and we lived within our means, it meant that we didn't have to force her when she was old enough to just take any job. So she was able to choose a career. So we always felt that we'd lifted her out of poverty. So although obviously we were not poor, but we'd lifted her out of that cycle of poverty. And then unfortunately, obviously, as we all know, housing is in such short supply. She's ended up in a private rented accommodation, twice the amount of money that I'm paying. So it sort of dragged her back down again. So that's showing there's not enough social housing for young people or young families that want to start their life journey. So with the findings, I wasn't actually surprised to some of the findings that we found. I was actually quite disappointed because if I'm talking about my life experience in 1988, we're now in 2025 and we're still no further forward, then that just seems shameful. It just seems shameful. So in terms of some of the other findings, though, for me, I didn't have the problems that some of the other participants had. So I hadn't struggled with the mental health and things like that and the stability because I had it. So obviously, as I said, that was one other driver for me to get involved in this, because I think that we need to start understanding that housing is the foundation of somebody's start of life into adulthood. And just briefly, the other things around a conclusion from this is that I think that we need more affordable, accessible and adaptable homes. So as I've just alluded, that my needs had changed. So I needed to obviously move around into a bigger property. When we build housing, we need to be building housing in areas that people have set down roots, not expecting someone to go miles away, because that is a big stress. I do think that having a home reduces stress and anxiety, and it gives people that foundation to build a better life. So because it gives that security, and it's not about just surviving, it's more about having that opportunity to aspire, achieve and thrive. So that's really what, from my perspective, that I'm pushing that forward, and that's why I got involved. So I know that they did want people that just moved into social housing from other environments, but when I heard about the project, I wanted to get involved, because although I'm happy and settled, I think that much more can be done by governments and by those decision makers that build homes for people. That's it. Thank you.
That is marvellous. Thank you so much, Jane. Really useful to get your perspective, and I really appreciate how open you've been about the kind of, you know, where you started as well and how you feel about social housing now, and the fact that it's helped you navigate some challenges you've had in your life, and then you're willing to put the time back so other people get to benefit from it too. If people haven't already, I mean, I'm sure most of the people here have already looked at the interim report. I think the thing that's really powerful, as well as the findings, is the case studies in there. And you read them and you think, oh, thank goodness those people are in social housing now, because some of the case studies, the situations that people have come from before, and I know we know all of this and that's why we're here, but some of the kind of the circumstances that people describe that they were living in before social housing, it's just really powerful. We've got some comments, including from Natalie, which is really helpful. Thanks, Natalie, about the framing work that Hannah referred to. So do have a look at the link that Natalie from JRF has popped in the comments. If you've got questions, do get them in, and we'll come to them as they come in. Hannah, tell us, you mentioned you talked to the Labour Party conference about this. Like, how is it? What's the kind of interest been? How has it landed? Have people been like, oh, didn't know that? Or is it like, what's the sort of sense been when you've been talking to people about it since you published it?
Yes, so I think when we took it to Labour Party conference, that was sort of the key way we wanted to launch the September report. I think actually quite a lot of the time was maybe similar to what Jane was saying, was that actually some of the findings aren't that surprising, or they're quite intuitive, but what it gives people is that, I guess, that evidence base to point to. So when we talk about, you know, stable, affordable homes being good for people's health, we can actually point to this finding, which clearly suggests that, because I think often, yeah, it sort of feels intuitive, but it's having that evidence base. So I think the sort of the findings around health are perhaps just really useful to have the evidence base. I think the finding that, and so yeah, we've had positive feedback from kind of sector organisations and kind of MPs that we were speaking to about it at Party conference. I think one of the findings that people are a bit surprised by is that, which I mentioned in the slides, is around the finding around debt, and people actually saying they're no longer in debt within 3 months. I think that's something that, seeing that quite short term, kind of quite significant improvement. I think we don't exactly know kind of the level of debt people are in, but either way, that's really significant. And I think is also important when we think about improvements to health, because obviously if you're suddenly, you know, you're not in debt, the stress around that is gone as well. So some of those improvements around kind of, the debt one was perhaps a bit more surprising to people, but generally I think people are saying it's really useful to have sort of the base to make the arguments, or to say things that they kind of intuitively knew about social homes.
And do you think, Hannah, like some of the findings, I'm thinking in particular around the kind of improvement to mental health, and also like my kids now have somewhere to play, like can you see this leading to like different partnerships and different advocates for social housing? Because there's a very well evidenced mental health challenge in this country, right? And actually we don't necessarily think, I mean, I think again we probably do, but others don't necessarily think about the link between mental health and housing, or, you know, kids going to school without anywhere to do their homework. Do you see this being able to kind of help us form new partnerships and bring in new advocates for social housing?
Yeah, it's a really great question. I think yes, definitely. So it's definitely something that we're kind of aware of in our broader social housing work. So how can we work more with kind of, children's charities, for example, kind of people working in that space, or health is obviously a key focus. And obviously if we have this kind of really rich, detailed data which delves into these specific parts of people's lives, that will then be a great opportunity to kind of work more collaboratively, and maybe get people kind of talking about need for social homes, maybe who wouldn't have, or it's not a key part of their kind of current focus. So that's definitely something that will be kind of planning to do in the next phase of the campaign, when we have like the full set of findings, and we really have those detailed findings. And I think yeah, sort of children and education is something we're going to be looking at a lot more in the later phases. So I think that's going to be a key one, as well as health.
Great, thanks, Hannah. Maria, one of the conversations we were having early on in this, and you touched on it in your presentation, but how you can kind of reflect where people have come from, right? Because often how they feel about where they live now is going to be in comparison to where they came from before. And there's, temporary accommodation, some of the case studies in there are, like I said, really compelling. But temporary accommodation is very different from someone who might have been sleeping on, sharing a room or staying with a relative, or had moved out of kind of private rent, which is sort of okay, but bankrupting them. How did you, can you just say a little bit more about how you take that into account through the research? And this is a question that I've asked Maria lots of times. So sorry, Maria, I'm just asking you for everyone else's benefit now.
I think that's a great question, and I think it speaks to why this research project is so important, because it allows us to understand that there's no one experience or one kind of benefit of moving into social home, right? What is a very significant change for someone might be very, very small change to other people, right? And I think understanding how diverse these experiences are and linking them, as you're saying, to their previous experiences, I think that's really one of the kind of key key I think impact that this research project can have, right? So even within, let's say, experience of people who move from temporary accommodation, we can say that, so for example, noise, lack of noise, right? Ability to control their cooking experiences, ability to have control over the space is much more important as an impact than, for example, someone who might be moving from a privately rented sector, where they have quite a bit of that control anyway, right? But their experience might be around more longer term stability, about affordability. So I think by really allowing for the kind of complexity in how we understand the impact of social housing to different groups, I think then we can also, just to follow up what Hannah was saying, shelter can have that more targeted campaigns, or understanding that different social housing has different impact on different groups. I hope that I have answered the question, Catherine.
Yeah, thanks, Maria. It's really useful, because I just think it's quite hard to just, like you say, you have to take it on face value a little bit, don't you? Because you can't possibly account for everybody's individual circumstances of where they've come from. But yeah, I think that probably is like a question for Jane, because I also think it's not just where people have come from, is it? It's where people have moved to, and the kind of social housing they've moved into. And because there is huge pressure on social housing, it's quite hard to get a social home now, isn't it? And I would imagine lots of people just, take what they can get, even if it's not exactly what they were hoping for, as you were saying, Jane, maybe not in the area that they really wanted or with enough bedrooms. Does that worry you, Jane, that there is so much pressure in the system that social housing is great, but it's not, people are not always in the right home?
I think so, because we need to have a more holistic approach, because I think obviously I started off in a flat, I then ended up in a house, and obviously as I age I might want to end up in a bungalow, which would be nice, because we've got to remember that there are an aging population. Housing stocks were decimated back in the 1980s when everybody rushed. So the baby boomers rushed and all bought houses. But obviously those stocks have depleted, and we haven't thought about the future. We haven't thought about people's changing needs. So obviously, as I age, I would hope that I would still be able to stay in the area where I live, but there would be social housing accommodation that would be suitable for me to move, so that the cycle of housing sort of goes round and round. But it doesn't seem to. It does worry me that I may end up like my elderly relatives in properties that are so unsuitable, but because house prices are so silly, they can't sell the property to buy something smaller, because they haven't got the money. They can't get mortgages because they're of a certain age group, because obviously to get a mortgage, You need to be able to fulfill the mortgage contract. So I just think that I get that we need to build houses, but we need to start talking to those residents that will be accessing that housing. So instead of saying we're going to build this for you, we are going to build this with you, consult with you, and then build the houses that are necessary to sort of sustain a tenancy as our needs change. So not sure whether I've answered your question there, but I do think that we're missing a trick here. If there is all this money, we need to stop. I get people want to buy houses, and that's great, but we need to stop thinking it's all about buying a house. It's not all about buying a house, because a house is just a home. So to me, we need to we need to start talking social housing. We need to stop all this stigma about social housing, because there are some very educated people, there are some very articulate people, and we just get this bad press, sadly, about social housing tenants. All the tenants I've ever engaged with all over the years have been lovely people. It's been like a lovely community, and we need to start celebrating that a bit more, instead of looking at trying to pick out the negative, because there's lots of positives about being a social rented tenant. I feel very happy.
Thanks, Jane. It's really nice to hear from you as well, and like with a good news story, it's lovely. Hannah, do you have any reflections on that kind of? It's not just where people have come from, but how suitable their social home is for them, pressures on waiting list, and how you might use this research to influence not just the numbers, but what is built. Because like I said, the research is really positive in that it's showing the value of social housing, but that won't be true for that won't be everybody's experience. We talk a lot about the quality of social housing, and I don't want to take us down that road, but how does this sit with you in terms of, like, we want more, but it has to, for people to have the experience that you've articulated in this research, it has to be the right home for them, doesn't it?
Definitely, yeah. No, really important question, and I think, Jane, your thoughts on this are really important. I guess from a shelter perspective, so from like a wider campaign, I maybe briefly mentioned when I talked through, but one of the focuses of our kind of campaigns on social housing over the next year is going to be around kind of how can we make sure we're building the sort of right types of homes in the right places, because as you say, obviously the overall number of social homes is really important, and as an organisation we'll kind of continue to call for 90,000 social homes a year. But I guess taking into account the investment that we had in the spending review, we're kind of focusing a bit more on making sure the homes that are built with that money and through kind of other means are the homes that people kind of genuinely need. So particularly focusing on the need for kind of family sized homes, worrying that to kind of meet the 1.5 million target the government have made, they might just sort of build in kind of cheaper areas potentially, and the sort of easiest to build homes rather than the ones that are most needed. So that's going to be a focus, and I guess also thinking about whether homes are accessible if they need to be, and whether they're in the locations that people want to live. And then I guess from the research perspective, that's something that we sort of aligned with the project from the outset. So we sort of asked a range of questions around kind of people's experience of moving into a social home, whether it met their expectations, and we also asked questions around the quality of the home and things like that. So I guess the overall aim is kind of to support and show the benefits of social housing, but we will also be looking at I guess sort of delving into in the later, when we have sort of a bigger sample, who might be experiencing who might have the more positive experience, and what might be driving that, whether it's experiences of where they were before or the actual home. And so that we'll be looking at kind of whether that can support some of that work around
that's really helpful, Hannah, because it's about space, isn't it, and bedrooms, but it's also, you can tell from people who've responded, who've been part of this project, that kind of people feeling part of a neighborhood and included and space for kids to play, that has like implications for like design standards and like, you know, planning and all those kinds of things, that if you want people to get the full benefit from social housing, you have to try and build those things in. And like, Hannah, I'm amazed that you talked about building that you haven't, because I talk about it all the time. Steve Reed's our Secretary of State's Build Baby Build hat, because we might get him a hat made that says build baby build, but the right homes in the right places and of the right quality, please. But I'm not sure it'll fit on a cap. Maria, did you want to come in, and then we'll take some closing reflections.
I mean, now I want a hat or a t-shirt, but very quickly, first what I found very surprised, well, maybe I shouldn't be surprised, I don't know, but almost nearly all of the interviews, the vast majority of interviews, I don't have the number from the top of my head, said that they waited for social housing less than they expected, or about the time that they expected. And I think there's something also about how we talk about social housing and how we kind of have so many negative narratives that we also sometimes miss the positive stories that actually people do get. You know, there is a shortage, but there's a lot of people who actually get their needs met. And I also just wanted to add to what Hannah was saying. I think it really speaks to the importance of running longitudinal studies, right? So we only have like a year and a half, 2 years to track people's lives over time. And even during that time, people's lives changes, right? Their finances changes. They, you know, we interviewed people who said they you know, in half a year, they'll pay off the, you know, the expenses of moving in, or the furniture, and their situation will change. Their kids will go to school and their situation will change. And I think, you know, what if we could get back to these people in 5 years and 10 years to really understand it, or kind of highlight that people's needs change. And to just speaking to what Jane was also saying, that housing needs to adapt to that, right? And they need to kind of respond to the different types of needs that people have. So you know, it's fantastic that Shelter is making a case for more housing. I would also be making a case for more research for researchers in the room. Yeah, thank you.
That's really helpful. Thanks, Maria. There's just one question from Tom in the chat, Maria. The people you surveyed, were they living in housing association homes, local authority homes? Do you know, can you cut the data by that? Can you just come back on that one quickly?
Yes, so we do trace that, and we'll be able to kind of compare these experiences in our final report. We haven't refocused on that in this interim report, but 100% we do track whether they live in a local authority or housing association properties.
Great, thanks, Maria. This hour has gone like amazingly quickly. Before we let our fantastic panelists get on with their, it's Thursday, isn't it? Get on with their Thursday. Let's just take one closing reflection from each of you. Jane, let's go to you first. Any kind of final kind of comments or reflections that you wanted to share with the audience?
Okay, so build, but consult with the people that you're going to build for. Talk to them about the types of homes that they need. Invest in the types of homes that they need to free up bigger homes for families, etc. But don't just build. Think about building communities, because that's what you're doing. A house is not just a house. It's a home. It's a community. It's a shared responsibility with everybody that you live in that street with. So think about that. That's it.
Lovely, thank you, Jane. When I'm in charge of the world, I'm going to make you housing minister. Maria, any kind of closing reflections from you?
So I think my reflections, I guess, sticking to the kind of theme of delivering the research, it's quite a complex project that requires a lot of coordination between many, over nearly 3 dozen of delivery partners. But I just want to say that putting effort into involving people with lived experience and being honest with them and maintaining those relationships, it definitely made the project much better from a research perspective. And I think it will also show in the way that we communicate findings and in the way we frame the findings, because we had that kind of support and input from early on.
Brilliant. Thanks, Maria. Hannah, what about you?
Yeah, I guess it's just really kind of reinforced the importance of making sure we use the detailed data we're getting from this to kind of support that insight around where we should be building, what are the benefits, where do we see those benefits and why, and kind of making sure we're really embedding that in as part of our kind of ongoing campaign work.
Great stuff, thank you. We've come to the end of our hour together, which I said I don't know where the last hour has gone. This has been a really fascinating and useful conversation. It's been a real privilege for me to be involved in this work because, like I said, it's the first time I've seen something which is really about the experience of people who've been moved into social housing. So a huge thank you to those of you who've been involved. If you could thank Jane and Hannah and Maria in the usual, whether that's like a virtual thumbs up, a virtual clap, in every way, whichever way you choose to thank them, please say thank you. There you go, some hearts, some claps. There you go. You've been brilliant. Thank you so much. And I think if you came today, we will share the link to the report and some of the other things that have been mentioned. So we'll send a follow-up so you'll get everything that you need from today's conversation. But thank you from me to all of you for coming along and for being part of this conversation. As I said, thank you to our fantastic panelists, and also a big thank you to Cash, who have supported this webinar. Thanks all.
Thanks everyone.
Thank you. Thanks.